Right.
This continues well beyond. And so just because they've reached their due date, they're not just a typical term baby. You're going to have care beyond that. It's going to require follow-up. Not in all cases, but in a lot of those cases. So knowing your child's medical history that well, because you've spent that time at the hospital, is vital. But also just knowing the terms that went with it, and just the more time you spend here, you learn those things. And so I think that having that information from the nurses and being able to carry that on to the doctors, a lot of doctors look at me like, are you a nurse?
And that educational piece, if we had a baby that had to go home on an apnea monitor or whatever, that parent knows, we've taught them.
Yes.
They know exactly what to do when they take that fragile baby home.
There's also a fear factor as a parent, because when they hand you that baby to go home and you've been dealing with this for 2 months, you're going home with that baby who may or may not be on a monitor, but suddenly they're not hooked up to a heart rate monitor, or they're not hooked up to, are they breathing, are they not breathing? It's very scary. So it's just that education piece that you need as a parent of a preemie baby.
And Megan,